I think Evo's really taking advantage of the next generation of software, so it's embedding AI into everything we do, but also it has other functions and features to enable teams to communicate more effectively together, because often, regardless of which sector you work in, you sometimes find that you have disparate teams that just can't work effectively together, particularly if they're on different platforms doing the jobs that they're doing.
Mm-hmm. And how is this different from how healthcare technology has worked previously?
Well, I think most healthcare technology has been very much siloed, so they've worked in their own space. So if you're on the EPR, you're doing stuff on there, but then you might be in maternity or theatres or ED, and they've got separate systems to do that. So there's always been a problem with how you get multidisciplinary teams working effectively together in a healthcare environment. And what Evo enables them to do is to see key information being fed to them from different systems, the things that affect them in the jobs that they're doing. But also it's going to enable them to use Copilot and AI over all of those systems as well, which is going to transform the way they work.
What are the one or two kind of key things that would really change the way it would work for healthcare professionals in the front line?
Well, I think look at our basic system, we've spent a lot of money redesigning that to make the user front end more friendly. For instance, looking at the appointment screens. But I think Evo is going to transform the way they interact with our systems, almost to a point of an extreme of still thinking, well, will they go through the screens in the systems rather than saying, just show me all my appointments today in Copilot, and suddenly you've got them all there. You've not had to go through screens to look at it, or give me a summary of a specific patient and what's happening with them, or give me a diagram, a chart of somebody's mood over the last 5 days. These are sorts of things that they just simply can't do in clinical systems very easily. And I think Evo is going to really transform the way they interact with systems as well as the way they work together.
Great. And you mentioned the likes of feeds in Copilot there. What does Evo actually look like in terms of its features and functionality within the platform itself?
Well, I think the first thing is our customers like the fact that we're bringing all the solutions into one place, so they're not having to switch around between systems. It's all within the one window. I think the next bit is with Copilot, is that Copilot's trained for the persona that you want it to use for it, so it's more relevant in the things it's looking for. But also, Copilot is not in the public domain, it's within their domain, and so it's all privately secure to the hospital. So if we're asking questions around clinical information and patients in particular, your data is secure with that. And I think the other aspect of it is the feed and receiving alerts. So if I'm a community nurse, I might receive a feed that says one of my patients is now being admitted to hospital. So I can look at where they are in my appointment schedule and make sure that I'm not going to turn up to an appointment where the patient's not going to be there. So all of those things, just taking those little pieces individually, are pretty useful anyway, but when you bring them all together collectively, then you really make a difference to how people work.
And you mentioned those that are out in the community. Is this desktop and mobile based?
So Evo comes with a mobile app as well, so you can receive your feeds on your mobile, so you're getting live alerts as to what's happening with your patients. And we will get to a point where we also prioritise those types of alerts. So we might have alerts and we might have high priority alerts, high priority being something that you need to action imminently in the next few hours, whereas an alert is just something to let you know something's changed with that individual. So I think we are looking at how do we introduce Evo to our customers, because this is a big digital transformation. This is a totally different way of interacting with your systems. So we're doing a lot of work at the moment to understand how do we introduce that gradually to customers. For instance, if you take an observation system, one of the alerts that might come out of an observation system is that somebody's missed an observation. But when it does, you do want to alert somebody, but who do you alert? Is it the people on that ward? Is it the people running those shifts, the service manager, the ward managers? And then you have to consider What happens if it's 30 minutes before the end of the shift? Do you have to alert the next shift as well? A lot of things to consider as to how we bring that sort of tech in, and we're doing a lot of work internally at the moment first to help educate the customers around how these workflows are configured and who alerts who and when do they alert them. So it's not going to be a straightforward transition. It's going to be something that has to have a lot of thought put into it. But I think the opportunity for the trust to really make a difference with how they work is enormous.
And given this is new technology for us in the market and to our customers, I know that you've been in lots of conversations with customers, making them aware of our plans around Access Evo. What's some of the feedback been from our customers where you've had those conversations?
Well, everybody we've shown Evo to in some of the demo videos, but in context of a journey of a nurse, for instance, has just been completely blown away with it. They just said it's transformational. Everyone says it's transformational every time we show it. But it's also quite daunting because of the amount of digital change. I think it's the first time, certainly in my experience in here, we're running faster than our customers can potentially keep up with us. So we've got to work closely with them to understand how do we bring them on that journey with us and support them in the best way we can.
And then looking ahead, things are moving at a very fast pace. We want to bring this out to our customers as soon as we can. What excites you the most about the platform as we head into the future, the opportunities?
I think the platform brings a lot of things, but I think a lot of things we're going to plug into the platform as well. Some software that we're going to be giving to our customers for free, part of that platform, like our Engage product, for instance, that will allow customers to have internal conversations. We can publish things onto that platform as well. Instead of them trying to have conversations in things like WhatsApp groups, we're going to offer them a secure environment in which they can do that. And even sometimes some of the simple things that, I was with a customer last week who said, actually, if you give us a desk booking application, that would just solve an immediate problem for us. They're the sort of apps that we're going to put into the platform. We're going to be able to give our customers things for free. And they're things that will make a difference to them. And I think that's really exciting to be able to be doing that for the NHS.
Right. And you mentioned there solutions like Engage and desk booking. That's not our usual range of products or portfolios we've been speaking to our customers about. So what are some of the other solutions we're looking to introduce into Evo as part of our wider Access group?
So we're having now a big push into the corporate world of the NHS. Everybody's got targets for reducing cost, but there's really nothing that we can't do in that corporate side of things. We have products for recruitment, rostering, scheduling, catering, finance, invoice processing, early payments, expenses, so there's a whole suite of products that we can put all in one place for the customer, whether they're looking at clinical products or corporate products. And I think we can absolutely transform the way the whole of the organisation works rather than just the clinical part.
Brilliant. And presumably the likes of Copilot and Feeds allows users to access all of those systems in one place, but also use Copilot to question the different products that they have access to. So for example, a clinician being able to submit their expenses and request holiday all in one place. Is that right?
Yeah, everybody will work with the products that they have in their particular portfolio for their role. So not everybody will necessarily have access to everything, but they'll have access to everything that they need to do their jobs.
Okay, very exciting plans ahead then, Steve. Thank you very much for joining us and talking us through Evo.
Great, thanks a lot.